We're pleased to be able to tell people when they have a diagnosis of rheumatoid arthritis that we have excellent medications that will change the course of the illness. They should be hopeful that they will get into a state where they will do well. There's a little aphorism: medications don't work in those who don't take them. Sounds self-evident. But when you have a chronic disease, the tendency is always to back off when you start feeling well. It is important to emphasize that the medications work when you take them. Good news is that oftentimes we can taper those medications to find the least that you need. We have another little aphorism: as much as you need, no more than you require. But most people will require medication over time. So taking medications, having a discussion with your healthcare provider, your rheumatologist, is really important. In looking at rheumatoid arthritis, we have very effective therapies, and currently not only do we have effective legacy medications, we also have effective new medications. There's a lot of information, a lot of research going on looking at how best to look after people in terms of what we call a model of care, an approach to treatment. And fortunately, these days, more and more of us are looking at the patient to be an active member of that team. So not only should you expect medication to help you, but you should expect your healthcare team to be your team on your side to give you the best possible outcome. When we're treating rheumatoid arthritis, which is a medication-dependent disease, you're not going to get over it by wishing it away, and we haven't found any other natural diets or other things that'll make a difference. Medications really make a difference. Our approach in the past was to sneak up on it and try and scare it away from you using medications. Now our approach is much like cancer, and I use the cancer analogy reservedly, is to say, this is something that's been brewing for longer than you've been aware. Has to be controlled from the get-go. And I can tell you that the faster we get it under control, the more likely we are to get it under control in a sustained fashion. And almost non-intuitively, that occurs with less medication. So when we start your medications, in our particular practice, we start with optimal dosing of methotrexate. Sometimes we'll add some vitamins, natural therapy, to try and reduce some of the side effect profile, and then we move you on. So taking the medications is really important, with the hope and plan that we'll be able to taper that off. So it's all about setting goals that are realistic and goals that are met by both the physician as well as the person who has arthritis, so that we can move on.